Welcome back to Living Out Loud. I'm Susan Karp, the Executive Director of the Arlington Council on Aging. Once again, we have Mark Waxmonsky as one of our primary guests. Today we have a topic of bladder health. Mark, welcome.
Thank you. So when you think about your health, you often think about your bladder and keeping that healthy.
Do I?
Yes.
No, when I...
You can say yes. It's not,
Oh, yes.
Okay.
Yes, I do. Yes.
All right.
All right.
Do you feel like most people think about, when they think about their health, they're considering their bladder health?
No.
Why do you think that is?
I think most people probably think about their bladder when they have to urinate.
Mm-hmm.
And they think that it's just going to always be there.
Or maybe when there's pain, or they're going in the middle of the night, or they're having incontinence issues, or...
I'd probably say pain or incontinence is probably something when people are more alerted. They probably think that waking up and having to urinate at night is probably just an act of aging, an act of...
Which it can be, which we'll talk about.
Okay.
And so I want to discuss some of those pieces of considering our bladder and our overall health. Often gets neglected unless there's a problem going too much at night, if there's pain, if your urine's cloudy, if
there are bubbles.
If there are bubbles. There's some
tiny
schools
bubbles.
of thought about that, but maybe not for this conversation. So really I just wanted to talk about bladder health, what to be mindful of, what to talk to your doctor about, what to do for prevention tips, those type things. So everyone is affected by bladder health, and as we know, as we age, our bladder changes a little bit in terms of how we're able to manage it and the different things that can go on. So as we know, a bladder is a hollow organ that stores urine. It's part of the urinary system, and the urinary system also includes the ureters, the kidney, and the urethra. So urethra, bladder, ureters, and kidney. So ureter is a tube that connects the kidney to the bladder, and urethra connects the bladder to the outside of the body.
We should have had a diagram.
We can perhaps do that on the slides and
All right.
post it on here. So again, we know that the body makes urine to remove wastes from our body, and the amount of urine in our body depends on a couple of factors. Fluid, how much you're intaking, fluid loss, if you're sweating a lot, if you're perspiring a lot, if you're breathing a lot, and the medicines you take as well. We oftentimes hear about water pills that make us go more often, and we'll talk about that as well.
Okay.
So any questions about the bladder, the urinary system, anything like that?
Well, you know what crossed my mind, and it may be in a discussion later on in this program, but when you're retaining water, are you retaining fluid in your bladder, or are you just retaining water in parts of your body?
It can be parts of the body, and not often, or oftentimes, it may not translate to going into the bladder. So if you're having puffy feet, for example, you may have issues with a couple of things, protein intake, cardiac issues, and if you're not excreting water, getting rid of the water that's collecting in your body, it can go to other organ systems and spaces inside our body that starts collecting. So
All right.
The edema in our feet and the urine that's in our bladder aren't necessarily correlated.
Oh, all right. Well, thanks. So let's just jump right in. I mean, how does the bladder change with age?
Sure. So as we age, our bladder becomes a little bit less elastic, so it can't expand as well. It's almost like a flat tire, so to speak. So when we are collecting urine, it may feel like we have to go more frequently because it can't expand to fill with urine, and because it can't expand, you have that sensation that you have to go more frequently.
Okay.
And also our pelvic muscles tend to weaken, which helps support the bladder. So it's just not as strong as the support. So again, our bladder becomes a little bit less elastic, and we don't have the muscles to support it, so it can't hold a larger amount of urine, which gives a sensation that we have to go more frequently.
Oh, all right.
Generally.
Generally.
And so the problems that can develop, which we kind of talked about before, so lower urinary tract symptoms, lower urinary tract symptoms, which I'll talk about in a second. Bladder infections, bladder cancers, prostate problems can also affect the bladder as well.
All right.
Which can increase with age. Does that make sense?
It can.
Okay.
Yep.
And so, again, it's very difficult when we start having bladder problems to have sometimes an increased quality of life. Some folks, if they're going very frequently throughout the day, they have to plan where the next bathroom is. They have to time certain
I was
things.
just going to say,
shopping, to go to the bathroom.
Yep. Or even
can't
for a
do
walk.
Or for a walk, social events, different things like that. So that can significantly impact someone's life. In addition to, if you're going very frequently at nighttime, you're getting poor sleep.
Yeah.
Which translates to poor quality of living during the day,
Right.
and so those type things.
Okay.
It can be kind of embarrassing as well if we start to get incontinent and we have episodes of incontinence in a social place or out in public. That can be difficult as well. So we often don't think about it until it becomes a problem, but it's still certainly good to be mindful of it so that when it does become a problem, it can be managed well and kind of go from there.
All right.
Does that make sense?
It does.
So I talked about lower urinary tract symptoms. It's kind of a conglomerate of systems, and it means trouble urinating, the leaking of urine, loss of bladder control, and the frequent sensation to urinate. So those are kind of the overall symptoms that someone may experience that there's a problem going on. So symptoms are caused by, again, we talked about weakening of the pelvic muscles, losing the elasticity of the bladder, and then sometimes issues with our urethra as well. And oftentimes when we think of bladder problems, sometimes the first thing we think of are urinary tract infections,
Right.
Which are very common, especially as we age. UTIs can happen, the short is UTIs, that can happen inside the kidney, the urethra, the bladder themselves, and the ureters as well. And if not treated, can spread to other areas of the body and can cause some significant systemic issues as well that we need some inpatient hospitalization stuff.
Okay, so now I have some questions on a UTI. And
Sure.
if this is later, you just say it's going to be later. But some of the symptoms with the older adult that has a UTI. So you don't necessarily have to have pain when you urinate for a UTI. And I think that's, it's pain that typically trips you into, oh, I need to get an appointment with a doctor. The older you get, you may encounter situations where you have a UTI with no pain. So then some of the symptoms that are created from that are
Confusion. Confusion, disorientation, altered behavior is quite common, again, as we age with someone who has a UTI. So you mentioned different types of symptoms, and it's true that not everyone's going to have the classic signs and symptoms of a UTI. They may have some of them, they may have none at all,
Right.
they may present with confusion, they may not have any of those whatsoever. So the classic signs and symptoms of a UTI is going more frequently, pain when you're avoiding urine, cloudy urine, very, very foul smelling urine. You may have a low-grade fever as well, and obviously that burning sensation when you're voiding. Some folks have blood in their urine as well, which sometimes can be difficult to tell because you can't really see blood cells on a microscopic level. Sometimes there may be frank blood in the urine that you can tell that present as a problem. So again, it's very important that, as you mentioned, the confusion piece.
Right.
So if your grandmother, yourself, is not behaving properly, or at baseline something's odd, you may want to obviously take them to the doctor to be assessed and do a urinalysis to see if there's bacteria in the urine, if there's white blood cells, if
Right.
there's different things in the urine, where the provider would diagnose that person with a UTI to be treated.
Yep.
And quite often, when they have those behavioral disturbances, when you start antibiotics, those disturbances go away very, very quickly, and treatment's done, and the UTI is cleared, and they go back to being how they behave normally.
Right, and it's very interesting that something as simple as, I'm saying as simple as, it's really not simple, for a urinary tract infection, that can really trigger that cognitive change that some may just say, oh, could be dementia, could be Alzheimer's, could be, I'm not going to say a psychotic break, but there's some behaviors that can be really exaggerated.
So when folks have a UTI, they get delirious. So the difference between delirium and dementia's it's slower, it's insidious. You may know some things here or there, there's good days or bad days.
Right.
Delirium, Related to a UTI, it's a rapid onset, it's acute. So literally one day they'll be fine, next day they're behaving bizarre, odd, that type thing.
All right.
And then subsequently when you're treated, you go back to being baseline. So dementia is long-term insidious, delirium is acute and short, and quite profound as well, with an aggregate of a whole different types of symptoms you'll see all at once.
Yeah. All right, great, thank you.
And so, trying to get back on track here. So another issue with bladder infections or UTIs are bladder infections, so cystitis, so an actual infection inside the bladder itself. Similar to UTIs caused by bacteria that can lead to similar symptoms of a UTI. It's just the UTI is in a different spot. It's in the bladder as opposed to general. A UTI is a general term for it, so cystitis, so the bladder infection, just happen the infection's inside the bladder.
Okay.
If that makes sense.
Yeah.
So how to prevent UTIs? So certain wiping techniques when you're using the toilet, so wiping from front to back when using. Drinking a lot of fluids often, so having good fluid intake. You know, we talk about being hydrated, help to clear the kidneys, clear the ureters, clear the bladder, clear the urethra of anything that may be there. Avoiding urine after intercourse as well. Wearing cotton underwear, loose-fitting clothing. And some studies have shown that the use of cranberry tablets or drinking cranberry juice can help prevent UTIs, but obviously to talk to your doctor first before having inordinate amounts of cranberry juice or wanting to supplement using those, the cranberry stuff there. So
Okay.
a couple of things you can do to prevent UTIs, and obviously being mindful of the signs and symptoms so that if it starts early, get treatment and not have any nefarious effects from it. Any questions about UTIs, preventing?
No, I was always thinking though, they always say drink a lot of water. Some days I drink a ton of water, never once have to urinate. Other times I have 4 ounces of whatever, and I have to urinate all day. So what's up with that bladder? You
I
don't
can't
know.
tell with
Go
your
to the
specific
doctor.
bladder, but if you're having those issues, please speak to your doctor.
Please speak to my
So
doctor.
when to call your doctor? Again, we talked about if you're experiencing signs and symptoms of a UTI, talk to your doctor if you start becoming incontinent more frequently. If you're going too much, talk to your doctor. If you're going too little, talk to your doctor. Sometimes with incontinence, you can take certain medications to help retain more fluid, more urine, which will make your quality of life a little bit different. And those medications are often pretty safe, not a whole bunch of side effects with those.
Yeah.
But will be important to, if you have a UTI, to stop those medications so that you can clear the UTI a little bit easier.
Yeah.
Let's see, and again, if you notice any type of blood in your urine, or again, we talked about frequency, or if it's cloudy, or if
Color,
it's
it's
smelling
color,
bad.
smell,
Frequency.
and bubbles.
I haven't heard, I don't know.
Bubbles, if you have a lot of bubbles.
I'll have to do more research.
You'll have
about
to
the
do more
bubbles.
research, but if you have a lot of bubbles,
Okay.
like bubble bath bubbles.
I haven't heard that, so. But that's a good point about.
I think that's more, actually that's more kidney. I am not a doctor. Do not run to your doctor and say, this is what you heard on this show.
found bubbles, right?
I found bubbles. Do more research.
And so you mentioned the color as well. So we know that the clearer the urine is, the more hydrated you are.
Yeah.
And the more concentrated, the more yellow, the more dark yellow, the more dehydrated you are.
Right, and it's that dark yellow that I was just thinking back to the segment that we did earlier in the summer about dehydration. A darker urine. Drink more water.
Drink more water.
Drink more water.
So that's.
And if you've been eating beets, you can count on a pinkish or a red urine.
Yep. And asparagus, I think it's what, orange?
It smells. No, asparagus
Smells.
It smells. That's the bad smell. That doesn't mean you have an infection.
So how to keep your bladder healthy? We talked about drinking enough fluids, especially water. Limit the intake of alcohol and other caffeinated beverages. Have a healthy weight. You could do some pelvic floor muscle exercises as well to keep that taut and firm. Quit smoking. And if you can avoid constipation, that can help as well because of the stress you're putting on one, retaining stool, and then when you're trying to avoid stool, can lead to other issues with your bladder as well.
Really?
So,
I would
try
not
to
have
keep
thought
a
about that.
regular,
Okay.
Try to keep a regular
All right.
bowel movement frequency.
All right. I'll work on that.
And so that's pretty much it. Again, we talked about bladder health, how it's important for our overall health. We talked about UTIs, the signs and symptoms. We talked about cystitis, which is an infection of the bladder.
Yep.
We talked about when to call your doctor, and some ways to keep your bladder healthy. So, do you have any other thoughts, questions?
No,
about bladder health?
it's always very interesting, and as I said earlier, it's I've always found it amazing how a UTI can impact a senior's health with regards to the cognitive or the behavior changes. And so oftentimes than not, that's the culprit of that immediate onset of change. So no, Mark, actually I think it is very interesting. It gives me something, a different perspective, that I don't need to think about my bladder just when it's time to go, but how to keep it healthy otherwise. So I want to thank you very much for joining us today.
Thank you for inviting me.
We are very appreciative that you stopped by to join us about bladder health. If you have any questions, you can always give Mark a call.
And if you have interest in learning about other topics, give me a call as well.
Right, we're always very interested on the health topics. What is your need there? And always, ever any question about your own health, you call your doctor immediately. Do not wait for that next appointment. All right?
That's it.
Thank you for joining us.
Thank you.